All right, good evening and welcome to this Saturday evening panel discussion. We're glad for all of you who have come out tonight or haven't come out tonight, but are sitting at home or wherever that is to think about some questions and some things related to COVID-19 and the disruptions in our lives that we're all dealing with right now. So we have several panelists here who are looking forward to answering some questions and sharing some ideas and to help us think about how we can best navigate some of these very new and different times. So I'll just let each of them introduce themselves, and we'll start with Seth, and then to Gordon, and then to Karen as well.
Thank you, Brian. So I am Seth Martin. I think many of you know me. I go to Blue Ball Mennonite Church, and I am currently a first-year medical student at Hershey. So I guess we'll be talking a little bit about the basic science of the virus, and that's something that I'm sort of immersed in right now in school. That's one thing we're focusing on, all the basic science behind the medicine that I hope to practice eventually. As far as plans, I think many of you know that I am hoping to be a family doctor. And yeah, that's a little bit about me. I'm currently at my home in East Earl, not the one in Hershey. So I guess we can pass it on to Gordon.
Good evening, everyone. I'm Gordon Wagler. I'm originally from South Carolina. So I have come up to Hershey for residency. I did medical school at University of South Carolina in Columbia, South Carolina, and then did my clinicals at a regional site. I'm an intern, which means I'm a first-year resident in internal medicine at Hershey. Right now, I'm about 1.5 miles from the Hershey parking lot. I live real close. Today was my day off. I love medicine. I couldn't imagine doing anything else. I go to church when I get a chance, and I'm not constrained by the virus or working. As an intern, you work quite a bit of Sundays, but at Weavertown Mennonite in Burdenham. And I need a haircut. The barber shops are closed right now. And so my hair is very long, and I don't like that. But anyway, that's how it is right now.
I would not have noticed if you would not have said.
Hello, my name is Karen Conley. I am a nurse at the local maternity hospital. I've been a nurse for 20 years. I've also taught a little bit of nursing, specifically pediatrics. And before I worked at the hospital, I worked in a doctor's office. I'm a member of the River Brethren Church, and I am at home in my city home in Lancaster.
All right. And well, welcome to each of you. And why don't we go ahead and get started? The first question is sort of a general science question. You know, this COVID-19 is caused by a virus, and does somebody just want to explain the terminology difference between coronavirus and COVID-19? What are the words we should be using to talk about this?
I can say a little bit about that one. So the coronavirus is, it's a large category of viruses that have been around. Coronaviruses have caused the common cold for some years. And the novel coronavirus, the one that we're currently worried about, is also called SARS-CoV-2. And let me see if I can get what that stands for. severe acute respiratory syndrome. And then the CoV part stands for coronavirus. And the 2 part indicates that there's a SARS-CoV-1, which is what we commonly would recall as SARS from a few years ago. I think it was right around 2011. So you have coronavirus, which is the broad category, SARS-CoV-2, which is the specific virus. And then there is COVID-19, which is an acronym of sorts, which stands for coronavirus disease in 2019. So the CO is for coronavirus, CO is for corona, VI is for virus, D is for disease, and 19 stands for 2019. As far as what term you use, probably doesn't matter. I think most people know what you're talking about.
Yeah, very good. Thank you for that. And so thinking about the specific virus, let's broaden a little bit and think about a virus in general. So what's the mechanism for a virus to sort of replicate, and how does it make us sick?
I can kind of take that one. Viruses, you're dealing with a lot of RNA, which is kind of similar to DNA. And a lot of this is spread via respiratory droplets. And so the reason for the 6-foot distancing, where they say social distancing, is because the droplets can be spread when you cough, when you sneeze, or even talking. And so that's why a lot of the, we can get into this a little later, but a lot of the societies out there, the CDC, the World Health Organization, are suggesting to maintain a distance of 6 feet. And the reason for that is because droplets typically do not travel more than 6 feet. And they don't typically linger in the air. Now, some say maybe they can. It's kind of there's a lot we don't know about this virus. Most of the time they don't linger in the air. And so that's a little bit of how the virus spreads. And a little bit of why they're calling this social distancing is because of the respiratory droplets. It's not contact, although you can get it that way, but also when you sneeze or cough, they come out of your mouth and nose and kind of spread into the air, but they also kind of drop relatively quickly. And that's why the 6-foot rule exists.
All right, well, yeah, thank you for that. And what about surfaces? How do we know how long this virus can stay on a surface? That somebody, say, touches a doorknob and then I go through after them and touch my nose like I shouldn't do. But how long do we know anything on the research about that?
I've seen a variety of numbers, a range from a couple of hours to a couple of days, on the order of 5 days or a week sometimes. So I don't think there's consensus on this. I don't think everybody agrees on a certain number, but it's something to keep in mind when you think about being around sick people, or if you're in a public environment. Just keep in mind that if you rub your hand on something or touch anything, there's a decent chance that there's leftover coronavirus there from the last sick person who went through.
Mm-hmm. And that's a good point. You bring up some different numbers there. You know, there's a lot of things we really don't know yet about this virus. It's a new one, and scientists are working hard at trying to discover some of these things, but we simply don't know all the answers yet. And that's maybe why you see some things changing with recommendations and that kind of thing, which we'll discuss in a little later. But good to think about that. All right, so another question: where did this virus come from? I think probably everybody knows that it came from China, but you know, I've been hearing things. Well, pangolins, bats escaped from a laboratory. What do we know so far about that?
I have a few things there. I'm just gonna pull up my notes here so I say what I was intending to say. So I think the prevailing explanation right now is that it is spread from an animal of some sort. The term for that is zoonotic, something that jumps from an animal to humans, or it even applies to transmission the other way, but we're not usually concerned about that. Zoonotic is easy to remember because it begins with Z-O-O, zoo, think animals. So I think that's the prevailing explanation. Another one that I've heard is that it was released on purpose. And there is good information that that is almost certainly false. There was a team of biologists in California that they compared the coronavirus that we're worried about to the other ones that are in circulation. And they were very similar. They weren't able to identify any manipulation that had been done on this new virus. So purposeful release, probably not. There's been I've heard over the last couple of days, a resurgence of this idea that it escaped from a lab. Currently, that looks like it's unconfirmed. It sounds like there's some evidence on both sides of the table that it just came from an animal or that it escaped from a lab, but we don't know.
And I'll just add to that, that and this goes for everything we say tonight, be very careful when you Google things. Google is a very wonderful tool, but there's a lot of disinformation out there as well. There's a couple of websites that I would strongly recommend that you look to as kind of your measure to go by, and your golden, the truth, basically. And we can talk about this a little later as well. It's like, what is we as Mennonites and Anabaptists trust? But a couple of those are the World Health Organization, otherwise known as WHO, and the CDC. And the CDC actually has a lot of information out there about how's the virus transmitted, why are we doing social distancing, where's the virus come from? I'm not sure if that's on there, but a lot of good information out there. So I would say even like CNBC, Fox, CNN, Huffington Post, any of those websites, for sure, Facebook and Twitter, that be very careful when you read those. And it's not wrong to read them, but take them with a grain of salt and basically trust only a few. CDC, the World Health Organization, Johns Hopkins has a website out there about the number of cases. Even be careful with things like WebMD, things like that. A lot of those things are, could be true, but a lot of them are not necessarily true. You can also look at the FDA website, the Federal Drug Administration, Food and Drug Administration, for what's approved right now as far as treatments. And so, especially when it comes to like disseminating information about, oh my goodness, like it was a bioweapon, terror weapon or something like that. Just be very careful what you read and take it with a grain of salt, because a lot of these things are, especially like blogs, just be very careful. I'll just say that in general, and especially as it relates to where this came from.
Okay, thank you. Karen, did you have anything you wanted to add there?
Yeah, they used to say that paper will stay still for anything, and the internet is the same way. And in fact, it has wider distribution than paper. So it's not that people can't air their opinions, but and certainly many of them have a little piece of truth, which is why they stay around. But as far as I know, nobody knows everything about the virus. And so if they come across as some kind of definitive authority, be very suspicious. We're still learning about it. That's the whole thing. That's why it's a new virus. Mm-hmm. That's why you hear what seems to be conflicting information, because as they learn things and add advice, sometimes it will actually conflict what was said earlier. And it's not that they're being two-faced, it's that they understand it better or differently now.
Right.
There was, I was going to say something about, I think when you were explaining that was it Gordon was explaining that it's a respiratory disease, so it's spread by droplets that are expelled through the mouth or nose. But we also call it a contact disease because those droplets fall onto surfaces. The virus is in the droplets, so then it changes from being droplet to contact. So, and of course, our hands are forever touching our faces. So this is why it's both airborne and contact, because our respiratory secretions start to contaminate all the surfaces around us. Just to clear that up, because it sounded a little bit there for a moment like it was only respiratory, but it's a combination.
Mm-hmm.
There's a question that seems like it would fit so good right here. I don't know if you want it or not. The question is a drop on a doorknob 5 days later as potent as someone coughing on you? Do you want to take that now, or do you want to, I know, Gordon, you were thinking to go to the end.
Yeah, I mean, I can answer that one. This is my gut feeling. I would say that no, it's not. Because when you are coughing, you're exposed, there's a lot of droplets that come out, as opposed to on a doorknob, you get one or two. Now there's not information on this specific virus yet that I know of that would have that, whether or not like it's as potent. Now, maybe there is, I haven't looked. But I'd also say, back to your point, Karen, is that you can also have this through, it's also been found in fecal matter as well. So it's not just the respiratory droplets in contact, it's also fecal matter. But as far as being potent, I would say no, because you have a lot more when you sneeze as opposed to being on the doorknob. But somebody else might have a different thought on that as well.
I just have a little bit there. So as soon as the virus leaves your body, some of it starts to die, right? So the amount of virus in a droplet that has fallen onto a surface will slowly decline over time. So if someone sneezes on you, that's like fresh, high concentration virus expelled onto you in droplets. And the little droplet that's on the door, who knows how long it's been there. So a lot of the virus that's in it may have died. So I would say less potent because there's less virus there.
My understanding is there's something about viral load and how much virus you're exposed to, which is why otherwise healthy people who are in healthcare are getting sick because of the constant ongoing exposure. That's my understanding, versus someone who may be exposed for a few hours and then is completely removed from the patient. Is that accurate?
All right, and sort of related to what you were saying, Karen, with the CDC now recommending that people wear masks in public, and I think Pennsylvania actually requiring it starting tomorrow or something like that. What changed? What did we learn that we now decided, oh, maybe we should be wearing masks?
So that's very interesting. What I'm telling people is you're wearing the mask to protect other people. The assumption is that you might be sick and you might spread it, because you're not wearing an N95 mask that's going to protect you from other people. But by you wearing the mask, if you are sick, there very few droplets will hopefully get into circulation in the air around you. So the best way to control an invisible illness that is mild for a lot of people is to assume that everybody is sick and try to minimize exposure for everybody. That's my understanding of why we're wearing masks.
I have a few comments there.
Also,
go ahead, Karen.
I've also heard that you should treat your mask kind of like your underwear and wash it often, because it's contaminated once you've worn it for a day. Don't wear the same mask for weeks on end, please.
Wow, I was thinking Rosalind's overdoing it, but okay, she's doing it just right then. My wife, Rosalind, she's washing it very regularly.
Good.
Okay, so my thoughts on that. As Karen mentioned, I think the changing recommendations is a reflection of the way science works. At any given time, A scientist will say, this is what we know, and this is what we've decided based on that knowledge. And as I'm sure you've noticed, we've been learning a lot about this virus day by day. So the knowledge that we have on hand changes, and that means that our recommendations will change. As I understand, early on, it was thought that this is a small virus we're dealing with, and wearing a mask will be pointless because the virus is so small it could just go through. As our understanding developed, we realized that now the virus is actually in droplets, which are maybe about 100 times bigger than the virus itself, and the mask can actually stop those, or some of them. So it might be worthwhile to wear a mask. There's a balancing consideration here. So we'll talk about social or physical distancing maybe a little bit more later, but that is probably the most effective thing we can do. And we, when I say we, I'm going to say the federal government here, people at the CDC and such organizations would be concerned that people who wear a mask would get a false sense of security about how much virus they're shedding. So if you wear a mask, you might feel safer than you actually are. And let me get my thoughts together here. If they had implemented mask wearing first, we might not have been as quick to take up social distancing because we were already wearing masks. Any thoughts about that from the panel?
Makes sense.
Yeah, I hadn't heard that, but I totally agree. And I also agree with what you said, Karen. It's not, a handkerchief around your nose or anything other than a medical mask, which is like a surgical mask, or an N95, or wearing a helmet respirator like a space guy, is not going to protect you. It's going to protect other people. And so, it might protect you a little bit of like some of it, but it can still get down over top of your handkerchief and things like that. I will say this as well. I would, if you go to the grocery store, and I don't know if anybody's having church right now, but if you go out in public, I would shower when you get home. What I do when I get home from work, we have to wear scrubs in the hospital right now. Everyone's required. I throw all my things, not even in the hamper. I throw everything in the washing machine right away. And I don't wash it every day, but I throw it in the washer machine. That way, whatever's on there possibly will not be spreading around my apartment. And so that's what I try to do.
So the moral of the story is, just because you have a mask on doesn't mean you can go about your daily living. Obviously, like we've been talking about, if you do have it and you take the mask off and you touch where you coughed on, well, then it's on your fingers, and then you're going to spread it around everything to other places that you touch. So you do want to be careful even while you're wearing a mask. And we had a question earlier about wearing a mask. Can somebody confirm that? I didn't look it up in a reputable source, but is Pennsylvania intending to require mask wearing starting next week? And also, if it's only a strong recommendation, would you recommend that we do that?
I think that it should be worn, especially in buildings, in any public spaces. Like if you have to go to the drugstore, the grocery store, the doctor, make sure that you're wearing a mask. When you're outdoors, unless you live in a busy city with crowded sidewalks, you're probably okay if you're not standing still in groups and talking. But as courtesy to the other citizens, if you don't want to draw a lot of glares and stares, you should be wearing a mask anytime you're going into buildings and public places.
I think also I agree with Karen, and I think I might go as far as to say to wear it just in general in public. The reason I say that is this: we as Anabaptists historically have been not too keen on going willy-nilly after what the government says, and I think it can actually, if Pennsylvania requires it, I would recommend you do it anyway if they don't. But I think Pennsylvania requires it next week, that it is not a good witness and it's not a good look for us as Anabaptists to do it. And I think a lot of times our witness has been hurt in the past because, oh, well, the Amish or the Mennonites or the River Brethren or whoever it is, we're kind of a special case, like, oh, well, just we don't have to do certain things. And I think that can be a hindrance to us. We are a people set apart, and I love that, and I like that about our culture. At the same time, I think we can set a very good example to our coworkers and to those people looking at us in the community that say, hey, they're also following these rules just because, they're conscientious objectors and they don't join military, they don't vote. They still follow the rules and regulations that the government has set out for us. And that can get kind of sticky when you say, well, you're not allowed to have church. Then you get into a thing of like, well, where, the Bible says we have to gather together. It's kind of like a communist country or something like that. I mean, we can get into that more. I don't want to get into that too much right now, but I don't think it's a good witness if you don't wear a mask.
Right.
I have a bit of a thought there. I think I'm going to come across a little less strong than the rest of the panel. Part of my goal for this session was to present you with some of the basic information about the virus, like how far it spreads and how contagious it is, and also to give you resources to do that on your own. And by all means, use your own head. So I think there's some common sense that plays in here. That being said, I also fully agree with what Gordon said about being a witness. And I guess where you can sort of make up your own mind a little more is if you're in your own office at work and there aren't many people around, what you do is a little more between you and God or whatever risk you want to take. So keep that in mind. That's my balancing opinion.
All right, very good. Yeah, and sort of related to that question is one on social distancing. So maybe the better way to say that is physical distancing. And we're stuck inside our houses and things like that. Is there any evidence that it's working? Why exactly should we stay away and not have that birthday party?
Yeah, there's an article, I think just recently. I'm sorry, I don't know if it was an article or an interview that was posted with some of the officials at the Lancaster General Hospital, and their belief is that things are working. I mean, they aren't overwhelmed, they'll readily say that, but then they're also quick to say it's because people are following the rules, they're doing the social distancing, and what we're trying to accomplish is being accomplished. They're not saying, oh, we were crying wolf. They're saying, it's working. We're not overwhelmed. We're seeing patients, but we're not, our resources are reaching.
I think another thing, going back to what Seth said about using your own judgment and things like that. Now, is the social distancing working? Probably. I haven't really done a whole lot of research into that. I will say this. I think a lot of Mennonites and Anabaptists like Ben Carson. And Ben Carson was quoted as saying something along these lines, is that 98% of the people who are infected are fine. But we're very much talking about the 2% that are dying or sick and things like that. And I will also say that he said we cannot be, I forget his exact words, but we can't be, have mass hysteria, basically. And I think that's what goes back to what Seth is saying. And Mennonites and Anabaptists in general are very good at not having hysteria. As far as, we're just all worried about this and things are crazy. I think there's a fine balance between having some common sense but also following the regulations that the government has set out for us. And so I think using common sense as long as you can, and maybe when you're in your office, you don't have to wear a mask. I just wanted to say what Ben Carson had said, because I think a lot of Mennonites respect him for the kind of man he is. And so it's not just us that are saying there's a lot of hysteria out there. And I'll even personally say, I think there's a lot more hysteria than is warranted in this situation.
I'll just say a little bit about some of the data I've seen. There was a paper from Japan, which I did not read. I just saw a summary of it, that after they implemented some of these fairly strict social distancing strategies and masks and things, their rates of seasonal flu dropped off, as well as their rates of coronavirus. So I think it's working for the flu. So I think that's that, we can compare that to last year. Unlike the coronavirus, we don't have anything to compare it to. So from a strictly scientific comparison point of view, it's hard for us to say that social distancing is the reason that the coronavirus isn't as bad, because we don't have a system where we just let people do whatever they want. That said, yeah, it looks like it's affecting other viruses. Like I said, in Japan, we see the drop off in the flu. So I think it's logical to say that the social distancing is helping keep the coronavirus from making its run in this country.
Yeah, and looking at the models from earlier, Dr. Fauci, the head of the National Institute of Health, or one of the subcategories there, if we wouldn't have done anything, the models suggest that we would have had 1 to 2 million people dying. And the fact that it's not nearly that high is sort of an attribute to the fact that it is working. And so some people are asking, well, why don't we just let everybody get it? And then hopefully if it works like influenza or something like that, we'll just become immune to it and we can go from there. And so the healthcare capacity and things like that, obviously. The other thing that we'll get a question here is about treatment. One of the reasons we can't allow just everybody to get it and then we're immune is because we can't really, we can treat it, but so some of the controversies surrounding that. I heard the other day that, if you take plenty of vitamin C, you won't get it. Or if you can hold your breath for 30 seconds, you don't have it, things like that. So what are some of the treatments and the drug trials that are going on in relation to the disease?
I don't have anything to say to drugs and trials. I think that's something for the medical doctors to handle here. But I would not totally discount things like vitamin C, garlic, avoiding too much sugar in your diet, getting rest, having good hygiene. All those things certainly help your immune system. They're not, we can't say that they're the cure, and what's wrong with the medical community that they aren't giving mega doses of vitamin C. But to discount, vitamin C has its place, and I take it. Any of those herbs that support the immune system certainly are not going to hurt, and you may as well take them. They're not a cure, but they may help to prevent and to strengthen your immune system. That's my persuasion.
So I can talk a little bit about vaccines. So one of the things that you normally want in a virus, now this is opposed to bacteria. Bacteria you don't vaccinate against, viruses you vaccinate against. There are numerous vaccine candidates out there that are being evaluated for prevention. There is also one of the interesting ones is one that can vaccinate you against tuberculosis. So there's right now there's nothing that is approved. And I for sure would not take anything, and this goes to even testing yourself for the virus. I would not take anything that is not approved as far as vaccines or medications that is not approved by the FDA, which is the Food and Drug Administration. There are a lot of companies out there, I think, that are trying to say like, oh, you can test yourself for the virus with this. Unless it is FDA or Food and Drug Administration approved, it wouldn't use it. I totally agree with Karen that doing some of these things like vitamin C and things like that are totally reasonable. Will they work? I don't know. Will they hurt? No. So I don't think there's any harm in trying. Absolutely. There's also a drug out there called hydroxychloroquine. It treats malaria. There's some interesting data out there about that. It is not, there are some trials out there, but nothing that has been slam dunk approved. There's also one called ivermectin that has some interesting data behind it. However, I don't know if it's been used out of the lab yet. And I'm not even sure if it's been used on animals. So there is a warning as well by the FDA. You can, I didn't know this, but you can get ivermectin for animals. And so please do not take ivermectin that is used for animals, not for human consumption. Will it hurt you? I have no idea, but there's a very good chance it could. It hasn't been evaluated for use in humans. And so please don't do anything that's designated for animals. There's also some others out there. And I don't know, Seth, if you have any that you want to talk about as well.
I have a few. So I'll corroborate what you said about ivermectin. All that I've seen is that it was used in a lab in a petri dish, and that it killed the coronavirus there. That's all we know. We don't know if it's safe for people to eat. One of the more promising ones I saw was called remdesivir. And let me just lay my eyes on my notes here. So it has been used in some small trials, and the number they give here is that there's a 68% rate of improvement. So that was in adults hospitalized with severe COVID-19. So we may see some updates on that in the future. And just to echo what Gordon said about taking things that are not approved for consumption, a lot of well-meaning people have tried that, and it didn't turn out well. So one of the examples that sticks in my mind is from Iran, I believe. There were, I think it was on the order of hundreds of people taking methanol because it was purported to keep them from getting the virus. And if you know anything about methanol, it's not good for people, and many people died. So in line with not being really crazy or really frustrated or scared out of your mind for this virus, by and large, people who get it are okay. Don't kill yourself trying to not get it.
All right. Well, thank you for that. I've also heard that, someone like me who's young and healthy, I don't really have to be worried about it. Is that true? And even if it is, why is that not maybe the best philosophy to have?
So you're right. It is not affecting healthy individuals as much. It can. It is a possibility. I think we have to be very careful when we say things like, "Oh, I'm fine. I don't need to be. I don't need to do anything about this because I'm 30 years old and I have no medical problems." It is true that it's not affecting children as much, and it's not affecting younger individuals as much. The more, it's called, I don't know if you have seen this out there, but there's something called comorbidities, which basically means you have the virus, but you also have a couple of other diseases like high blood pressure, diabetes, heart failure, things like that, COPD that can just decrease your immune system overall and make you a sicker person and a sicker patient. So you're right, it's not as deadly for healthy individuals and younger individuals, but it still can be. And I think taking the same precautions is important. But as far as grandparents, people over 70, 80 years old, people who have a lot of health problems, who are on any kind of immune system drugs, even more so, we should be very careful.
I found a nice summary statement from the CDC, and I'll just read it to you. Hospitalization rates increase with age and are highest among older adults. The majority of hospitalized patients have underlying conditions. So that's sort of the summary about who gets sick and how it affects people. So part of our role here, as for me as a younger person, is not to pass it on to other people. I might give a few numbers here. I wanted to fit this in somewhere, and this might be a good spot. So from the point that you breathe in the virus until you have symptoms is about 5 days for most people, but it can range for up to like 2 weeks. That's why you see this 14-day quarantine number all over the place. So there's a decent chance that you could have the virus and that you could be shedding it when you're talking or coughing or whatever, and you could give it to someone else, unawares to you or them. So that's our role. That's what I see my role is in not spreading stuff around. I probably won't die from it, but someone that I give it to could.
All right. So in thinking about that, we don't have anything for sure to cure it. Vaccines are in progress, but they're going to be another year out or something like that. What could this look like in the future? Am I going to have to wear a mask for the next year, or can it come back again? What is sort of the, and maybe I'll tie in with that, the sort of the phase back. I'm not sure if you want to get too much into politics and economics, but when stuff starts to get opened up again, what can I expect?
That's a very good question that I don't have an answer to. I will say this, and maybe I have somewhat of an answer, but emergency rooms right now are not crowded. So if you have a really bad problem right now, it's a good time to go to the emergency room, because people are not coming in with the little stomach aches and headaches and medication refills that they were before, because they're scared about the virus. How long that's going to last and how long people are going to be terrified of going in public. And I was in Giant the other day, and there was a line all the way back to the dairy section to even get in the checkout aisle. How long is this going to last? I think it's very political. And so this is a guess. This is not a scientific or medical guess. I would say within a couple months that people are going to be able to go out in public and not have to wear masks anymore. I would say within a couple months, but I really have no idea. This, to be totally honest with you, I have not been keeping up with the news. I don't have time for it, and I have better things to do with my time. But I think it's a lot of it is political, and the politics will be influenced by what the CDC and Dr. Fauci say, and I'll leave it at that. Maybe somebody else has something they would like, they differ on that.
Maybe a question to you.
I mean, I was just going to say, making an educated guess, I wonder if it won't become like some other outbreaks of contagious diseases where, oh, this city is having this resurgence of coronavirus, and so that city and its environs tighten up their measures and the rest of us go on with life as usual, that's something I could see ongoing. When we think this is done, it may continue to crop up occasionally in geographic locations, and you know, we'll hear about it, but hopefully it won't be on the news every single day anymore.
Yeah, and that's a good point. There have been other diseases, you know, thinking of Ebola in 2014, I think it was Kenya that had a case, and with they were able to shut things, they were able to shut it down, not the whole city and capital, but they limited it to 8 cases, and it was you know, in the largest city in Africa, and at the time it was quite scary. But through contact tracing and keeping people in isolation that displayed the symptoms, they limited it very well. I'm going to move on here to a question, and we are getting close to our hour here. We have about 13 minutes yet. There's a question about people dying from this. So I've heard some rumors that that people are just saying, well, this person died from COVID-12 because either the hospital wants more money from the government. How does it work in the healthcare setting for someone to pronounce someone dead? And is there any checks and balances out there that we can be assured that they're not just making numbers up?
That sounds like a great question for Gordon.
Unfortunately, yes. So I've pronounced 1 or 2 people so far as an intern. The process is pretty in depth. You have to fill out a form that says what the cause of death was, what the time of death was. To be totally honest with you, I am not sure what the process is for checking up on those things. A lot of times you can say things like, and I'll just speak a little medical jargon here, acute hypoxic respiratory failure secondary to COPD exacerbation. So basically someone can't breathe because they have COPD, and you can even say secondary to smoking. Now you could, for someone who dies of COVID, you could say acute respiratory failure secondary to pneumonia, secondary to COVID-19, and be done with it. Now, are those things checked up on? I have not been a doctor long enough to really know, and I haven't really delved into that because I haven't had to pronounce too many people as passing yet. I will say this. I would be very worried about any physician who does that. To be a physician, you have to have a very, and even a nurse, but as well, but as a physician, you have to be very ethical in what you do, because a lot of times there's not anyone looking over your shoulder. Sometimes there is, but you make a lot of decisions, and your word goes a long ways in determining what somebody died from and that type of thing. Now, does someone check up on those things? I'm not exactly sure, to be honest with you. They probably do, but again, I have not looked into that. As far as people, this is actually the first I've ever heard of it, of people saying they've died from this just to get money from the government. I would be very curious as to where that information was obtained. Was it obtained on a blog? Was it obtained on TV, in a newspaper, by rumor?
I think the question was, the hospital is getting it, so the doctors are saying this. Does that sharpen it up a little more?
The hospitals are getting money because the doctors are saying it?
Yeah, somehow there's this idea that if they say it's COVID, they get some kind of federal money or something. So there's an incentive for the hospital to label it that. If I'm reading the question correctly, just to clarify.
Yeah, I mean, I would not be surprised if that, I would be surprised if that's happened. Now, I can't say it hasn't, and that's definitely within the realm of possibility. Just because someone's a physician does not mean they're ethical, unfortunately, or a nurse or a pastor or a construction worker. But it would be unethical to say that, for sure. And to be honest, this is the first I've heard of it, and so I can't really speak further to it. But people die from one thing, and that's their heart stopping. What leads to that heart stopping is a whole bunch of different things. You can die from high blood pressure, you can die from an overwhelming stroke, but you can also die, if you have high blood pressure and diabetes, you can die from the COVID virus. That can be the straw that breaks the camel's back, so, as it were, if that makes sense. So they wouldn't have died if it wouldn't have been for the COVID virus. And so maybe that's kind of where people are getting this idea.
I have a thought there. So it would also be possible that people are dying from COVID who would have died anyway, right? And so the straw broke the camel's back sooner than it would have broken on its own. And it would be completely speculation to say how much that is influencing the COVID death numbers. I have no idea.
Yeah, and I would just third that. I was thinking some of the same things, that if you have an underlying heart condition, and you died before they actually had time to do the COVID testing, and then they do the testing, they find out that you had it. Because I think these post-mortem tests are some of the things that people were talking about. But there again, maybe you would still be living if you hadn't happened to get the COVID. So yes, your heart left you down, but the COVID virus is quite possibly what pushed you over the edge. And if they could put 2 reasons for cause of death on birth certificates, on death certificates, then perhaps they would, but they usually have 1. So that the numbers may seem to be skewed without them trying to skew the numbers per se.
All right. Yeah, and another question that came in about transmissibility. If I get infected, am I contagious right away, or how long does it take till I can be spreading the virus? And then after I recovered, can I still spread it to other people?
You can, and I apologize, I've been touching my face quite a bit. I didn't think about it, how much I touched my face. You can be infectious before you get sick, and that's the problem. You can, and like Seth was saying earlier, this virus can incubate for up to 5 days and even up to 2 weeks sometimes. But you can actually spread this virus before you're sick, because you have it in your system. As far as how long it lasts, it can last, I think, the symptoms can last. Definitely you should stay home when you're sick. But how long it lasts in your system, I am not sure about that. Maybe Seth, you have something, have you looked that up?
I don't know that either. And just to clarify your answer about when you first come in contact with the virus, you won't be contagious right away, but maybe within a day or 2.
Yeah, very good. Another question that someone had is about the virus itself. Is it a fat-coated protein, or there's different types of viruses, and some of are what I think is called encapsulated. Does anyone have anything about whether this is an encapsulated or not encapsulated virus?
I don't remember seeing if it has a capsule. I think I might say just a little bit about basic viral structure. So Gordon mentioned early on that there's an RNA component, which is like the instructions for making more virus particles, basically. And that's, for every virus, there's that genetic component inside a protein capsule of some sort. And then sometimes the capsule is wrapped in another thing, which is the question here that I'm not sure about. Some viruses have I don't even know. It could be fat, I suppose. I'm not sure of all the different kinds of capsules there are. But yeah, so the direct answer to that question is I'm not sure if it's actually a fat encapsulated virus.
And just to go back to the question before, I was looking up a little bit about how long should you stay away. if you have a fever, stay home. And that's basically, there was a study, 138 patients in Wuhan. Now this, who had COVID-19 pneumonia. The most common clinical features at the onset of illness were fever, 99%. And so if you have a fever, I know we didn't really give a satisfactory answer about how long you should stay home, but if you have a fever, you for sure need to stay home. I just wanted to go back to that point.
That's another thing I was thinking we should add too. So it's one thing to have the virus be out there and nobody's sure if they have it and what should we be doing and should we be concerned. But certainly anybody who's symptomatic or who has symptomatic family members needs to really up the ante as far as quarantining, taking precautions. Even if they were loosey-goosey before that, they have to get serious if anybody gets it, or it will spread like wildfire. I personally don't know anybody with it, except I think maybe a Facebook friend, and probably that's where most of us are. We're not aware of any actual cases, but sooner or later you will be aware of somebody. And at that point, if you've been careless before, you need to start behaving seriously, and treat it seriously, or it will get out of hand at that point.
All right, well, I think we have maybe one more question here, and then I will go around and give you each a time to sort of summarize anything you'd like to. What about those living or working in long-term care facilities and in hospitals? Do we have to be especially careful? Should we distance ourselves even longer than other people, or what are some recommendations there?
I can answer that for myself. Yes, I assume that I'm germier than my friends who don't work at a hospital or don't work at a long-term care facility. And so I'm distancing myself from my parents, for example, and I have my sister running errands for them more. That's just personally how my approach.
I have not had to distance myself too much from other people because I live it by myself. However, one of my fellow interns has a very sad story. He has a 2-year-old and his wife is pregnant, and he was exposed without proper PPE. He had a mask on, but it wasn't a respirator. He didn't have a gown on. And so his wife is making him sleep in the basement. And he FaceTimes with his son. And it's heartbreaking. So I would say yes, especially if you've been exposed. Right now, we all have to make a few sacrifices, some of us more than others. I have a 1-week-old nephew that I probably won't be able to see for a couple months because I don't know when the next time I'll be able to get to South Carolina is. But I think that's one of the lesser sacrifices that people are having to make when you have to sleep in the basement. I think right now it's not a bad idea to social distance yourself if you work in a nursing home. I have a cousin who's a nurse in South Carolina, and he is sleeping in the apartment as opposed to the rest of his family's dwelling. So I would recommend it. That's not necessarily based on any scientific evidence per se, but it is based on the scientific evidence that this thing can spread, and it's difficult if you are around people very closely. So I would recommend that.
All right, and one more question that came in. Apparently, Trump, in a passing comment, compared this to the Spanish flu. That was the last major public health crisis probably that the U.S. had. How does this compare to the Spanish flu from 1917, 1918? Do we have any data that compares the two yet?
I haven't seen any data comparing that, but I know someone who's contributing to this panel who's read some about it recently.
Are you trying to bounce that back to Brian?
Yes, or you. I hear you're reading about it, Matt.
Yeah, so I'm not a disease historian or anything like that, but you know, that was the last major one, and I think the thing to remember is that back in 1918, a lot of the deaths were from related causes, pneumonia and things like that. They didn't have antibiotics to treat those, and obviously they didn't have respirators and that kind of thing. So with our modern healthcare system, we can prevent a lot of those things. But if we practice some of the things we've learned in the past 100 years. So I don't think we're have to be scared that we're going to have 50 to 100 million people dead worldwide, and simply because we've come a long way in some medical understandings about disease transmissibility and that kind of thing. And so maybe I'll just transition right into a few summarizing comments that I've had or was thinking about, and that is, make sure you look at information that's reliable. And I'll just name a couple here. Obviously, the CDC website has a lot of information on it. It's not this nice graph, glitzy, glamoury type of page, but you know, if you want truth, oftentimes you have to go dig for it, and you might have to spend. You're not going to get a complete summary of everything that's happening and understand it in 2 or 3 minutes. You have to dedicate more time to that. So you have to go around and follow different links on their website to look at some of the statistics and things like that. And the White House Task Force also has a website that they've dedicated strictly for this. And let me just quickly look here, whitehouse.gov, and there's different aspects to that website, even as far as opening up all the technicalities of when a state is allowed to open up and that kind of thing. So accurate information on there. And like was mentioned before, Johns Hopkins as well. So I think at this point, we'll go the same as we did for the opening. Any closing comments that you wanted to make?
Okay, I wanted to add to your resource list there. So specifically for those people who are interested in the economic recovery coming up, the White House does have information, and that URL is simple to remember. It's just whitehouse.gov/opening America. And that outlines the federal guidelines for how they're recommending that governors handle their own states. So we're going to see probably over the next couple of days to a week the trickle down of that into actual day-to-day practical applications coming from Governor Wolf. And yeah, it's going to be different state by state. Some closing comments here. So I had a few things that I think apply especially for Christians. One thing I think we all have a handle on is that death is not the end for us. In Philippians chapter 4, it mentions the peace that passes all understanding. And I think our understanding of the world, of what reality really is, that there is a God and that there is a hereafter, sort of tempers the things that come up, you know, day by day, the coronavirus or other threats that other things that threaten our freedom and our livelihood. Gordon mentioned earlier the witness that we leave to others. I think that's something that we shouldn't let run our lives, but we need to take into account as Christians, especially something so simple as wearing a mask. It costs you essentially nothing. And sure, I had a little bit of pride issues when I first put it on to go shopping. I was like, wait, why am I doing this? But the fact that somebody could take offense, I think, is not worth it. Just wear a mask. And then my final point, we are directed to pray for leaders. In 1 Timothy, the first 2 verses of chapter 2 tells us to pray for our leaders. And I think especially if you think they're making foolish decisions, that would be a great thing. It would be, I think it's good for me, it's good for you and it moves God's hand. We know that the prayers of his people move God's hand. So I think I will pass it on with that.
I have a few things to share. I want to echo again our witness as well. I'm not sure how much we can help our witness right now, but I think we can definitely hurt it, depending on what we do during these situations as far as wearing masks or not. I will just say a practical thing, especially if you have to stay home from work right now. Find a new hobby. Read some good books. Read C.S. Lewis. Read G.K. Chesterton. Read something. If you play musical instruments, pick up a new musical instrument. If you like writing, write a book, or take walks outside, work out, do some aerobic exercise. Don't spend this time in isolation or quarantine and do nothing but sit on your couch and whatever you do, just, feeling sorry for yourself or feeling bored. This is an excellent time, especially if you have to stay home from work, to do something productive. Even if it's as simple as remodeling your bathroom, and I'm sure people are doing these type of things. But this is actually you can actually use this to your advantage. Catch up on some work if you wanted to put a garden in or whatever. Just use it. Don't sit at home bored. And the last thing I'll say is this. We are not the only ones who are, quote unquote, on the front lines as medical people. The people who are checking you out at the grocery stores, I would be more scared to do that than to work in a hospital. And right now I'm actually the residents are not allowed to have contact with the patients at this point. It's just the attendings who are the main doctors at the hospital. But the people who are checking you out at the grocery store, that's probably worse than being an intern on a floor that doesn't have any patients, because there's so many people who come through a store or at a gas station or public transit systems, like if you're driving, riding a bus in Harrisburg or Philly or something like that. So think about those people as well, and just pray for our country. There's a lot of fear out there right now, and there's a lot of people are not quite sure, what's the economy going to do and things like that. Just pray. I echo what Seth said. And don't touch your face.
Yeah, I would say this is a good time if you have extra time to study up on history. People keep referencing the Spanish flu, but the fact that our whole population is in such an uproar about needing to do certain things for the health of the larger society just goes to show how far we've come in the last 100, 200 years. I mean, quarantine used to be common. Every winter, people will be under quarantine for measles or diphtheria or this, that, and the other thing. And I think it also points out how much we are, how we value the individual or our individualism over the greater good sometimes. Yeah, it's one of the American gods is the individual. And I think that's something that we're all learning, not just as in our circles, but in the larger culture, is that we are all connected and what we do does matter and it does affect the people around us. So I think just approaching things with more humility. A verse that comes to mind is the verse that says, "Be swift to hear, slow to speak, slow to wrath." It's interesting to me that some of the people who know the most aren't, because of their responsibility, they have to say something. So they make statements, but truth be told, they'd rather not. They'd rather just, sit back and listen perhaps. Whereas people who have a whole lot to say, and you already know that they're not really an authority, but they have an awful lot to say. And so it makes me think of that verse again, be slow to speak, quick to hear. And yes, what were saying, looking around, reaching out to the people around you who are hurting, even if you don't agree with some of the rhetoric coming out of their mouths, realizing that behind that rhetoric is anxiety and perhaps fear, perhaps anger, and every crisis that we meet has a spiritual component to it. Being sensitive to that and reaching out to our fellow man in whatever way the Lord directs us to do.
All right. Well, thank you very much to the panel for spending some time and answering those questions, Seth and Gordon and Karen there, and Matt for taking care of some of the logistics surrounding that. Thank you to all of you who are listening via the phone or on Zoom or watching it on YouTube. Hopefully this was informative and gave you some ideas about how to navigate some of the questions related to these uncharted waters. And mostly, hopefully it was an encouragement to you that, God is in control, and no matter what happens, his promises stand true and he'll be with us. And as Christians, we have an opportunity to be joyful amidst these difficult and trying times, and we can be a witness to people who are maybe scared and overreacting. And I think I'll just put 1-2 plugs out there. If you are interested in ways that you can help, there are definitely things you can do. Number one, you can sew masks. We as Americans, the number of masks are going up rapidly, but there's still shortages, and Christian Aid is receiving those. So if you want to put your skills to work there, that would be one way. And another one is to feed healthcare workers. And if you go onto the webpage, feedourhealthworkers.org, you will see more information there about how you can help pack lunches that are being sent up to New York City to healthcare workers. So there's definitely opportunities for you to put some skills to good use and to bless others during this time. And with that, I will thank you and everyone once again for tuning in here tonight, and God bless you as you continue throughout your evening. Thank you.
Thank you.